Okay, so we're going to take a look at level 7 in aesthetic practice now and the Qualifi assignment support. So we're going to take a look at assignment 1 support now, which is linked to Unit AP 702 and it covers psychology of facial aesthetics. So really interesting assignment questions that you've got here. There are 4 questions and 4 parts to the question. The first one is analyse the key factors driving the growth of the facial aesthetics market, including cultural and social influences and emerging trends. We've then got 2 evaluation questions. The first one is evaluate the impact of aesthetic procedures generally on self-image and psychological well-being. Examine how aesthetic procedures have influenced people's perception of beauty and consider to what extent you feel it has contributed to the rising levels of body dissatisfaction in society. We've then got to evaluate the effectiveness of national guidelines for recognising, assessing, diagnosing and treating body dysmorphic disorder in adults and the value of screening tools and techniques used to identify BDD and other potential mental health issues. And then finally, analyse the potential consequence of carrying out facial aesthetic procedures on individuals with BDD or other relevant psychological vulnerabilities and discuss the strategies you should use to manage pre- and post-procedural psychological issues. So, quite a complex set of questions there. And again, we're just going to review key skills within this particular assignment. So this assignment does assess your ability to analyse, evaluate, examine and discuss. You're obviously going to be explaining in there as well. Analysing is where we break down and interpret information and research. Evaluate is where we judge and weigh up evidence. Examining is where we're going to be exploring with depth, and when we discuss, we're going to be presenting a balanced view. So all following sections need to show these skills within your own academic writing. And we're going to have a little look now at analysing key factors driving the growth of the facial aesthetics market. So try and think about the following again as prompts to help you, not by giving you the answers, but just things that you could include in your answering to help you write a really successful answer to these questions. First of all, if you think about things like economic factors, so affordability, accessibility of aesthetic procedures nowadays, the growth of private clinics that have popped up everywhere up and down the UK over the past couple of years. Try and think about cultural and social drivers as well, so celebrity influencers, celebrity endorsements, social media filters, beauty standards and even cosmetic tourism. You could be quite specific here with the examples you give and the areas out of the UK as well that are quite popular for aesthetic treatments and other cosmetic treatments. We could even discuss emerging trends here. So preventative aesthetics such as baby Botox, there's been a big trend of baby Botox recently. Also you could discuss the rise of male clients partaking in aesthetic treatments. We could even discuss Zoom and Snapchat dysmorphia since COVID. And make sure you don't just describe these trends. Analyse why they matter to the question and how they influence demand, and think about regional and or even generational differences as well. Try to make sure you don't just give superficial analysis. The examiner's going to want you to analyse in depth and in detail. So for example, by saying things like Instagram makes people want treatments without any deeper reasoning. So really go into detail with what you're saying. Don't be superficial, go in really deep with your analysis. And as well, try not to fail to link cultural influences to market growth as well, because that's quite a key thing to this question in this section. We're going to take a look at evaluating the impact of aesthetic procedures on self-image and psychological well-being now. So I'm going to just prompt you a little bit with things that I would be thinking about myself. So think about positive outcomes. Think about the fact that aesthetics and aesthetic procedures give people confidence. They make people feel better about themselves. They can improve people's quality of life. Think about things such as alignment of internal and external self-image, and then also think about the negative outcomes as well. So aesthetic addiction, dissatisfaction, not having their client kind of like needs met by having these treatments done. You could even discuss emotional dependency on having aesthetic procedures done. Within it, try to include in this section reference to theories of self-concept. You could particularly look at Carl Rogers' psychological theories here on self-concept. There's a plethora of information out there on the web, so many books on Carl Rogers' work on self-concept. You could also try to include here the fact that we're all different individually, so think about individual differences. Not all outcomes are universal. And you could also think about media messaging versus lived experiences. In addition, I would probably bring in something there about what actually counts as enhanced well-being and how do we actually measure it. So quite a lot for you there to think about on the impact of self-image and psychological well-being. In relation to examining aesthetic procedures and the perception of beauty and body dissatisfaction, this is a really interesting topic. And you could think here about the evolving definition of beauty, so things like symmetry, youth, flawlessness, all these ideas of flawlessness that we have at the moment, and the influence of the aesthetic ideal on public perception, so client motivation, mental health, for example, body dysmorphia and other psychological issues that it can bring forward. You could think about the following questions as prompts to help you. So think about whether aesthetic treatments can be liberating or pressuring. You could think about rising rates of dissatisfaction here in society. Is there a direct link or is there any correlation at all? And you could also use psychological studies or industry reports on rising procedures amongst young people here, making sure that you're referring to research thoroughly throughout and referencing properly. There's so much research on this that you can bring forward, so much really interesting research as well that you can use and refer to in your essay. In regards to evaluating national guidelines on body dysmorphic disorder, again, think about the following prompts to help you. So the NICE, NICE guidelines in the UK, do give recommendations for diagnosis of BDD and recommendations for treatment. And there are a plethora again of different screening tools used for BDD. So the BDDQ, cosmetic screening questionnaires, the DSM-5 BDD criteria checklist. There's so many different screening tools which should be done by medics only. Think about how effective these are within aesthetic and non-clinical settings though. So try and think about how effective they are, how they might not be effective to bring in a little bit of evaluation. And also think about whether practitioners are trained well enough to spot BDD and what barriers there are when it comes to effective identification. Generally, a lot of practitioners are not wised up about BDD. They don't know how to spot BDD until they actually do a level 5 in aesthetic in practice, unless they're a doctor or a GP or a specialist psychologist, for example. So it is really important that aesthetic practitioners are trained to spot BDD and they have the knowledge on where to signpost and who to signpost their clients to as well. So have a look at what the research what research there is out there. Have a look at the research that is on the barriers. What research have we got out there that discuss barriers when it comes to effective identification of BDD and other disorders and psychological issues as well. In relation to analysing consequences of treating individuals with BDD or psychological vulnerabilities, again you can think about these prompts. So think about what might go wrong. Think about dissatisfaction of client complaints, worsening symptoms. Also think about legal and ethical implications such as informed consent, fitness to treat. And also you could think about emotional dependency or harm from inappropriate procedures as well. We do have an ethical duty to say no to our clients, so that could be something that you bring forward within your argument. And also try and discuss the value of collaborating with mental health professionals as well, which is really important. In relation to strategies to manage pre and post procedural psychological issues, pre-procedural things are things such as robust consultation protocols, use of validated screening tools and referral pathways for suspected BDD or other psychological issues. Post-procedural, things like managing expectations, aftercare with emotional support, and following up with your client to monitor outcomes and well-being. These are just examples to start you off, so please make sure you do think of your own as well. Common mistakes we do see in students as answering is, again, relying too much on personal opinion or using anecdotes. So please, again, for level 7 qualification, don't personalise your essay too much. Refrain from using I too much, giving your opinion too much. Your writing should be reflecting current research that's out there. And remember that this is an academic piece of work at level 7. So if you read back your work and you don't feel like it reads like a level 7 essay, you need to go back, you need to have a look at your flow, your structure, your use of connectives, your use of referencing. And again, we do see another common mistake, and that is of listing facts with no analysis or relevance to practice. So please try to refrain from doing that. Your analysis needs to be deeply embedded within your work. As well, another common mistake I see generally with level 7 work is that students ignore counter arguments or alternative viewpoints. Make sure that you challenge everything that you read and everything that you put in your essay. Are there alternative viewpoints to the research that you've put in your essay? Are there counter arguments? If so, describe them, explain them, bring them into your answers to create some kind of evaluative debate. Make sure you do use the research to create an argument in your essay, because that's what your examiner is going to want you to see. Don't just take everything at face value and accept it as fact. As well, another common mistake we see in level 7 work for this assignment is not referring to national guidelines, so to the NICE, GMC, and this is a must for this assignment. You need to make sure you refer to national guidelines and explain them. Finally, another common mistake that we see, we've taken the top 5 really for level 7, is overgeneralising. So remember that psychological outcomes vary, okay? And resources to help you, so as well as the academy resources you'll have the NICE, the NICE guidelines on BDD that you can access at any time. They're online and they're free for you to access. We've got GMC, NMC and HCPC professional standards you can look at. There are some amazing peer-reviewed journals out there. One in particular, which is the Journal of Aesthetic Nursing on Body Image by BMJ Aesthetics. That's a great resource. And there's several books as well, several pieces of literature that have been brought out to help you with this assignment. In relation to final points, please make sure you refer to the general guidance for writing academically at level 7. That will help you massively, particularly if you've not written at level 7 before or you've not written at level 7 for years, because let's face it, we can kind of lose our skills sometimes when we're out of academia for a while. Always try and plan your structure, so plan your introduction, plan your subsections and plan your conclusion before you start your writing. And try and be objective and professional. So again, avoid judgmental language, avoid looking at one side of the argument and not another. Make sure you're using a correct referencing type, Harvard referencing, including a bibliography. That's really important to level 7. And again, use real world relevance. So think about why this matters in clinic, why this matters in the aesthetic industry. The essay is again 3,500 words, try not to exceed, make sure you write enough as well, so try and stay within that 10% on both sides, and the pass rate's 65%, so some final points there for you.